I would like to invoke the Saptaswaras here for us in this virtual room or the virtual hall. Saptaswaras are the backbone of Indian music, and Saptaswaras are considered to be devatas, having a sonal body and a psychic form. And these Saptaswaras, in the form of deities, they descend on the earth. We will invoke them to descend on earth and bless us, because we are here to understand the positive effects of music on the mind. As music therapists, we always believe that we need to have their blessings, because music is a primary medium of communication that music therapists work with patients or clients whom they serve. And it is important that we make use of these for us in an effective manner, and the clients or the patients, get benefited by this. So it's very appropriate. I feel that, we have to invoke the Saptaswaras to be with us and to bless all of us, and also to make us understand about the positive effects of music. I'm sharing here the very nice paintings of Sri S. Rajam, a great musician and a painter. He has beautifully depicted the sonal body of the swaras, the Saptaswaras. And I have also taken up the Dhyana Slokas from Sangeeta Kalpadrumam, and I would like to invoke the Saptaswaras now. वीणावन चिरवन जातको दोहलेना देवेन कामरिपुना परिरम्यमाना पासाङ्कुसाङ्कितक रामरुणावभासम् शाचीं समस्तजननी मनीषं नमामि 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 निस्सीमवाङ्मनसयोरधि दूरवर्ती यस्यामः त्वमवधारयुधुं चिरविरुद्धः पद्मासनोऽपि बरहास्य दशा स्थिरयादि कामाशबिन्दुग सुखनिवामनिशुं नमामि 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 स्वर्णाभिराम रुचुदोबलरूपवेषा वीणा विनोद कृतुकामृतु मीलिताक्षी देवीं दयादृतहृदया प्रणदिं कदेषु घान्तारमास्तितवतीम् अनिशं नमामि मन्दारकुन्द प्रतिरूपरूपा इन्दीवरायत विशालविलोलनेत्रा मन्दारकुन्द प्रतिरूपरूपा इन्दीवरायत विशालविलोलनेत्रा चन्दिरावनं धाम भक्त्यमस्वरमयि अनिशुं नमामि धाम मध्यमस्वरमयि अनिशुं नमामि वाणी न केवल महारियया विजित्य प्रीति प्रधा विककुलास्त स्वर्णवेद देवेन्द्र शेखरितपाद सरोजरेणु धाम पञ्चमस्वरमयि अनिशं नमामि अनिशं नमामि यस्यावपूर्णवसुधारस निर्विशेषम् पीहितं तदप्यतितरा नयनिर्महेशः आवीयमानवैतोऽपि तदातिदेवः तां दैवती मनुकृणन् मनीषम् नमामि 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 वर्णरशेषजनदाकृदयं कमावा सर्वे सगुणनिर्भर विवरमाङ्गीं सर्वप्रियां शशिकलाकलितावदंशां नैषादिदेवी भवती मनीषम् नमामि So I hope the Swara Devatas are with us and then they are casting their blessing on us. And the overview of this presentation would be, first we would be trying to understand the relationship between music and health. Then when we look at the mind-body connections influencing health. Then the positive effects of music on the mind. A little about Indian philosophical approach of using music as a health resource. Then we'll have an experiential session, a relaxation session. Then we would have the question and answer session and we would be discussing and the forum will be open for discussion. So we are going to look at first in what are the ways that we are exposed in our day-to-day life with music, because music is all pervasive and there is no one we can say that, without using music in one way or the other in our day-to-day lives. We listen to music every day. We listen to music to reduce boredom, to lift our moods, or to have positive emotions, or to have some positive memories of some event or some person that we would like to retrieve our memory about. Or it can be that we would like to reduce our stress and we would like to relax ourselves through music. Maybe the new mothers or the mothers would like to bond with the children and they find it as a medium of expression of their bonding with the infants, and probably they are singing lullabies. The children sing children songs and nursery rhymes. There are so many ways that we listen to music. When we go in the car, we switch on the audio system and we listen to music because we believe that listening to music gives us positive vibrations. We also feel that music is a way by which we can pray to God. To seek help from God, we use music maybe as a form of meditation. We may chant, and then we may use the chants as a way to pray to God. So there are so many ways by which we listen to music every day. Here, the meaning is wellness. We use this as a way by which we want to care for our wellness, and it is more a wellness tool, or we can say that it is a self-care tool that we use music in our everyday life in order to take care of our wellness. And it's not therapeutic, it's not music therapy, but it's a wellness initiative, or we can say that the steps that we are taking in our day-to-day life. If you want to look at music performance, it's not only that we listen to music, musicians performance, maybe in the form of concerts, or we may also sing at home. Singing is a way by which we engage probably in our day-to-day lives. We perform music. That's one way in which we are integrating music in our lives. It may be a formal way or in an informal way that we may be singing at home. Here also that we are using music because most of us, when we perform or when we sing, we feel comfortable. Sometimes we feel that we are taken to an altered state of consciousness. We feel completely relaxed, and we feel that we are in a meditative mood. And we also, whenever we want to express our emotions, whenever we want to regulate our emotions, we also sit and sing. And that's one way in which we use music for wellness, for bringing us satisfaction, for bringing us, it's a way by which, we express. It's a way by which, we integrate. It's a cultural experience for us. It's an expression of our culture. It's an expression of we sit and then sing probably during rituals, the social functions. It's a part of social functions and rituals. And that's one way of integrating music in our lives. Whereas that is also a wellness, probably an initiative by us. And if you look at music teaching, musicians, music teachers train students to sing well. And the goal here is to teach music to them, educate music to them, so that they develop the skills of singing. Probably they are prepared to perform, to conduct performances. There, the primary goal is to teach music to them, to improve their skills on music. The secondary benefits, probably they would have noticed, some of the teachers would have noticed that the children who come for music classes may have improved on their attention levels, focus, concentration. Probably the parents may say, probably the parents may tell the teachers that he's motivated a lot to come for music classes. We could see that he's motivated to a greater extent in his life, and he's very enthusiastic about his other activities and in singing. So these are the secondary benefits of music teaching that the music teachers may observe. Here also it's not therapy, but the basic goal is teaching music, but still music is integrated. Music is an everyday part of the music teachers. Singing in a community, again, is one way musicians engage in group singing. They facilitate active participation of people around them in a community to enjoy music, to make music in their own terms. It's not so formal as in the concert. It's to facilitate expression, it's to motivate them. It's also to see, it may be to facilitate an individual identity or a collective identity. So here also, the idea is that music is a way by which we bond together. We see it as a identity, a social identity, belonging to a group, engaged for enjoyment, or getting pleasure out of it, get into social rituals. Again, the idea is that we feel comfortable doing it, we enjoy it, and we feel motivated to do it, and we are engaging in these kind of experiences. But all these four quadrants, in the four quadrants, they are not considered to be therapy. When we look at music as medicine, the music has got lot of powers which you would have, even as a general public, we would have felt that in our lives. We don't need to be trained as music therapists to know the benefits of music, because we all integrate music in so many ways, as I was telling you, in whatever ways possible that we would like to use the music on, for relaxing us, for enjoyment, or to reduce boredom, or to sometimes to distract from something distressing. We focus on music, and sometimes we want to focus on music and not something else which we want to avoid. We do all these things. Music has got immense powers, and when the healthcare professionals use pre-recorded music and use headphones and use music to regulate the biological rhythms, there are many biological rhythms in our body. All the rhythms, it's only music in our body. We can say there's music inside us and there's music outside us. The music inside us in the form of rhythms: blood pressure, heartbeat, heart rate, circulation of blood, the sleep patterns that we have, the excretion. Name any organ, the way we walk, the temperature, the body temperature. Everything, all these rhythms have a music. We go to the doctor when we become sick, when we fall sick, the first thing that the doctors try to find out is about the biological rhythms in the body. What is the core body temperature, or what is our heartbeat? What's our blood pressure? Because anything that has gone wrong, it's off the rhythm, then it is off our health. The rhythm in our body is a way by which we understand health. It's a music in our body. When the music is lost, the health is lost. There's illness because the biological rhythms have lost their rhythm, the structure. Music medicine is trying to use the powers of music in order to regulate the biological rhythm. It is based on the direct effects of music. Music per se has got some biological effects, and we are going to deal with it. Look at what is the effect of music on the brain a little later. We have known that music can bring tears in our eyes. It can bring goosebumps on our skin. It can bring down shivers in our spine. We can feel rewarded and we can get chill experiences through music. There are so many ways. We sway our head, or we tap our feet, or we move our hands. We make a lot of movements when we are listening to music unconsciously. We don't make conscious efforts to move our body. So there are many ways biologically music induces changes in our body. And it also induces changes in our biological rhythms. It is possible that we can use consciously music, the power of music, to get direct benefits of music, and gradually adjust the rhythm of the body, the biological rhythms of the body according to music. Can be an external pacemaker when we can use music as medicine to gradually adjust the rhythms. When the blood pressure is very high, we can use a suitable music and appropriate music, controlling the different properties of music with slow tempo and probably a very soft timbre. working on the properties and very low volume. We can try to control the different properties of music and try to gradually adjust the biological rhythms to the rhythm of the music. And this we call as, the principles of entrainment in physics. This is a principle that people can use music, allied healthcare professionals and healthcare professionals, doctors and nurses and people, who are not skilled in music but still would like to have the power of music, passed on as benefit to the patients, can use music, pre-recorded music, musicians and music therapists can help them in trying to find out, what is the right kind of music which can relax them or which can work on the biological rhythms. Working on controlling the different elements of music. The different elements of music will be melody and rhythm and timbre, the tempo. So there are different elements of music. And music as medicine is relying on the direct benefits of music, relying on the powers of music, which we have seen in our day to day life, and using this as a biomedical approach to work on some of the symptoms of the disease, which are biological. If I have to give a very short introduction about music therapy, it's a separate discipline, it's a profession. Music therapists are trained to give music therapy as a treatment. So it's not a performance or it is singing, it is given as an intervention to people where there is a need, their health is to be restored. They professionally use the different elements of music in such a way that whenever there is a need in the patients, it is a restorative healthcare strategy, meaning music therapists work in a hospital or a rehabilitation center, or it may be in a school for children with special needs. They have developmental needs, probably learning disabilities or developmental delays. Music therapists work with them. Music therapists present music as an experience. Music has always been a personal experience for us. We can associate a particular piece of music, we can associate a specific memory about a person or an event, and we get a positive memory out of it. We may would like to go back to something that happened in our past life. And music is a way by which, it's a very easy way to retrieve the information. It is a personal experience. The music that can create positive emotions for us, it's a personal experience. Music therapists create musical experiences. They don't present music as a stimulus. They present music as an experience and they use music as a point of contact to communicate with people, to communicate with patients, to communicate with their clients. They are not substitute for doctors and they don't cure the disease. Music therapists don't cure cancer. Music therapists don't cure diabetes, but they work on enhancing the physical well-being. They work on enhancing the mental well-being. They work on enhancing the social well-being. We saw so many properties that, through music, we can make ourselves feel a part of the group, a part of the community. Or it is possible that we can use music to bring in positive emotions or to lift our mood. So there are different ways. There are physical properties of music, psychological properties of music, social properties of music, spiritual properties of music. And music therapists use all these properties and present music as an experience, present music as a point of contact to communicate with the people with whom they work. There is also a therapeutic relationship. Music therapy is not per se based on only the direct benefits of music on the patients, but it also depends on the qualities of the music therapist, the personality of the therapist, also on the relationship that they have with music. The therapeutic process also depends on the relationship the patient has with music. And apart from this, these two intra-musical relationships, one with the patient and music, and the other one the therapist and the music, there is also a therapeutic relationship between the therapist and the patient. I'm not going to go detail, but just want to give you an idea of, there is a difference between using music for wellness and health and using it as a therapy, because music therapy is both an art and science. When we listen to music, when we perform, when we use singing in community, or when we use music teaching, we are more concerned about the art. But music therapy is both art and science. The processes have to be explained. Why it happened, how the benefit happened, what is the impact biologically, psychologically, socially, what are the theories supporting, the benefits. How do I explain the processes? And that is where is music therapy, which is the focus is on the health of the patient. The focus is on enhancing health. So, if we go to the next slide, then probably, we will look at what is physical well-being, what is psychological well-being or mental well-being, and what is social well-being. World Health Organization, there was a big change in the paradigm of understanding what health is in 20th century. As early as in 1947, World Health Organization defined health to be a complete state of physical, mental, and social well-being. Until 1947, or until the 20th century, it was considered to be a state of disease, or if it is absence of disease, then it's supposed to be a healthy status. So in 1947, World Health Organization defined health to be a state of physical well-being, mental well-being, and social well-being. Whereas the mind, and it was determined that the function of the mind also was important. It is not enough. It's just that we are physically well. And what is physical well-being? Physical well-being is not just the state of being in a disease-free state. It's also that how we are uh, physically engaging in exercises, we are eating good food, and we are sleeping well, and we are trying to bring a balance between our mind and the body and the soul. That was considered to be a physical well-being. It was not just the status of the absence of disease. Mental well-being. What is mental well-being and what is mental health? It's defined to be a state of well-being where we are capable, or it is a capability to that we have to regulate our emotions, regulate our moods, regulate our feelings, regulate our thoughts in our day-to-day lives, and how it is possible for us to understand the emotions, feelings, and moods and thoughts of others, how we are able to adapt and change to the ups and lows of our day-to-day life, how we are coping up with stress, how we still keep motivated, and we cope with the stress, we are resilient, we are motivated, we are enthusiastic, and we live up to the work, up to the our potentials, full potentials. This determines the mental well-being. This is equally important for a person to be stated as healthy. And what is social well-being? Social well-being is something to do with our relationships, which is also very important in our lives. Relationship that we hold in our family, in our community, how we communicate with them, how we interact with them, how we are able to socialize with them. We are human beings, we are social animals. It's important that we love others. We are mutually dependent on others. We have to love others and we have to be loved. And what is important for this is the social connectedness and the bonding and the relationship that we hold. If we are able to hold positive relationships with people around us, then it is determining the social well-being in our lives, which is also equally important. And that was the definition of World Health Organization defining health to be a state of physical, mental, and social well-being. So the World Health Organization's focus is holistic approach to health. It's just that it's not that we should be looking at only the bodily needs or just the physical needs wherever there is some disease or illness, or it should also be an approach in which we look take care of our mind, we take care of our relationships, and also it's not just defining health, it's just that the hospitals and we also have to focus on measures, health promoting mechanisms in a holistic manner so that we treat the person as a whole. The hospitals treat the person as a whole, and it is just not the physical well-being, but also their psyche. It's also the mind, the functions of the mind. They have to be emotionally regulated. What are their thoughts? What are their moods? What are their feelings? What are their stress levels? Are they able to cope with the stress? Are they able to be in a state to uh, to to help or to find out whether they can get into a state in which they can prevent diseases? Do they use preventive healthcare strategies? Is it possible that we can help them to use preventive healthcare strategies on one side? That will be towards wellness. So it was whose focus that a holistic approach to health is needed, because no more it is just the physical health, it's also the mental health. That's what we are interested in today, that it is important. Positive emotions are important. There's a lot of research in 20th century and 21st century establishing the relationship between music and health and music and mental health, about how music can promote positive emotions,
Yeah.
promote positive thoughts, promote positive feelings. So I was suddenly muted. Is everything fine?
Yes, ma'am, there was some issue
Okay.
in between.
Yeah. Thank you, Sasha. So it's just to understand some basic things, to know about music therapy a little bit, and also to understand about how mental health is important and how music can support mental health. Basically, to know about the holistic health, wherein mental well-being is very important for a person to be considered healthy. So I want to introduce another two principles called pathogenesis and salutogenesis. And we are always looking at salutogenesis, but to understand what is salutogenesis, we are looking at what is pathogenesis. And pathogenesis is when we become sick, we go to the hospital, and the focus there is on factors influencing what is the cause for the disease, what is how to diagnose it, how to treat and cure. And music therapists work alongside doctors. They're not substitute for doctors. Music therapy is a complementary therapy, and they work in an augmentative with an augmentative responsibility with the doctors. And they also try to understand about how they can help the patients. So it is again a restorative healthcare strategy where health is lost. The doctors try to find out, the primary focus is on pathogenesis, which is trying to find out what is the cause for the disease, what is, how do we diagnose it, how do we treat it and cure it. It's curing the disease. But music therapists heal. So what is healing? Healing is something, trying to bring a balance between the mind, body, and the soul. It's more about feeling good in our body, mind, and the soul. It's more about feeling. It's not about science. It's not about documentation, but how we feel healed in our body and the mind and the soul. So the pathogenesis is focusing on factors influencing this. The salutogenesis is factors focusing on factors influencing health and wellness and holistic care. So we looked at what is health. It's a perfect state of physical well-being, psychological well-being, and social well-being. And later on, World Health Organization also added spiritual well-being to it. And the well-being of people, which is very important, and how it is important from this paradigm of looking at only pathogenesis, turn towards salutogenesis. That is where meditation and yoga and music are the ways by which our focus is to look at the connections between the body, mind, and the soul, and look at a holistic approach of treating the person as the whole. It's not treating the heart in ward number one, or it is treating the brain in ward number two, or in the special ward. It is treating the person as a whole, treating his emotions, treating his feelings, treating his thoughts, treating his how he's coping, his pain, his quality of life, about how he feels subjectively about what is this quality of life. And that is wherein salutogenesis is focusing on the health aspects, which is not just only the physical well-being, but also the psychological well-being or the mental well-being, which is basically, what we saw, the thoughts. These are the mental functions basically are, if you look at mental health and, what is the mind, the primary functions of the mind are emotions, behavior, and thoughts. And we have also the other dimensions like motivation, enthusiasm, personality, intelligence. They are also, part of, the mental, the functions of the mind. And we can say all this complex functions of behavior and cognition and emotions are all controlled by the brain. So we can say that brain is a seat of our mind, and our mental well-being is based on how the functions of our mind, which relate to emotions, behavior, and thought, and our state of motivation that we are in, our enthusiasm, and how we are able to in our day-to-day life do all our activities to the fullest potential. If you don't do that, then it's pathology. So we are going to look at how music is going to support pathogenesis. That is called music therapy, wherein it is trained, they know the sign, they have clinical skills to understand about the diseases, they work in an interdisciplinary team, and they work on improving the physical well-being because there are biological responses for music, there are psychological responses for music, there are social responses for music. So, knowing all these aspects and considering these aspects, they also look at if there is an unmet need. It may be biologically, or it may be psychologically, or it may be socially, or it may be spiritually. Because music therapy is a treatment. It is not a preventive healthcare strategy. It is given as a restorative healthcare strategy, but our focus is health, considering a holistic approach of treating the person. This is just, when we are restorative, it's expediting and facilitating recovery. An example would be a person who walks in a hospital scheduled for an MRI, and he has to take up this MRI as a diagnostic procedure to find out, what is wrong with him, and the clinicians have put him in. It's a very anxiety-provoking situation, and to know about what's going to be the outcome for MRA, or what's going to be, the result, and how am I going to deal with it if the result is going to be something like I need a treatment or a surgery, and how am I going to live my life after this? There are various psychological stressors that the patients are subjected to, or it is a cancer diagnosis, the prognosis of the treatment, the side effects of the treatment. How am I going to bear the expenses of the treatment? What are the procedures? How am I going to bear these procedures? They may be very painful. So there are so many psychological stresses that the patients may be then subjected to when they visit the hospital. Music therapists alongside medical professionals also work on reducing the anxiety, reducing the depressive feelings, improving the moods, improving the quality of life of the patients. And they are also augmentatively support the treatment goal of the doctors, wherein they expedite and facilitate recovery, because we know that the mind has an influence over the body. The mind is going to be negative, it's going to have a negative influence on the body. So it's going to be music therapy is a restorative strategy to expedite and facilitate, and palliative when cure is not possible. So it can be that if somebody has a heart failure and he's not, they are not able to cure him, but what way in which that we can improve his quality of life. If that is a strategy, probably it's music therapy, and Preventive is healing by improving resilience and coping with stress. How do we integrate in our day to day life to use music in such a way that we don't fall sick? So, that is music for health and wellness. So, that's wherein we are really wanting to know what music can act on the mind. Music is considered to be a mind body medicine, and music acts on the mind because music can give or it can facilitate, or it can impact our emotions positive, it can impact our thoughts positive. We can just reflect for a minute on how it can impact positively. We always resort to, if we want a good feeling, or we want to get into a specific mood, or we are feeling happy, we listen to music. We are feeling sad and we want to regulate our emotions, we listen to music, because music has a capacity to work on mediate on the emotions and cognition. We want to remember an incident, we want to remember a very positive incident in our lives, and we associate that with a particular musical piece, and when we listen to that music, we get reminded of that, which I was talking to you about. It relaxes the mind, it improves the mood, it reduces stress, it improves attention and focus. It's possible that we can distract ourselves from anything that is distressing if we are going to have mindfully listening to music, or it is a mindful way that if we are able to focus our attention and focus, it is possible that we can be distracted, and coupled with the distraction, if we're going to have positive emotions, it is possible that it has been researched and it indicated that music is a very effective analgesic. You can reduce the need for pain medication through music interventions, and music therapists are trained to work with in different levels to work in as a part of the pain management team. And World Health Organization recommends complementary therapies for pain management alongside the medical care. What are the responses, the biological responses of music? It stimulates motor responses. We're going to see later on, in what way music impacts the brain. So motor responses is something to do with the movement. It's that this is. Thank you. The central nervous system gets primed when we listen to music or when we engage in musical activities, and stimulates the motor area of the brain, which is responsible for making movement. And this is a principle why music is also used in neurological rehabilitation settings when patients, when they have traumatic brain injury, they have acquired brain injury, and when they are into stroke and when their movement is affected, it's a way by which music is a way by which we can stimulate motor responses. It stabilizes physiological parameters. There are changes in the autonomic responses, blood pressure, heart rate, pulse rate, respiratory rate. Researchers have indicated that these physiological parameters can be positively changed. Of course, what kind of music is completely different, but research has indicated that it can stabilize, regulate breathing patterns, and distract from pain. So these are certain biological aspects of the responses of music, and these are the responses which is relating to the functions of the mind. And you can see the connection that is made. Mind can influence the body, and the body can influence the mind. When we are sick, we don't feel very comfortable with our emotions and thoughts. How the mind is having an influence on the body also equally has an influence on the mind. Of course, we are looking at how music can influence the mind, which can influence the body and result in health related behaviors, positive health related behaviors. So that's our focus here, because we are looking at music and mental health well-being, but we also are trying to understand that the mind and the body are connected. They are not separate units and they are not compartmentalized. Music can act on the brain, which is a seat of brain is a seat of the mind, which can act on the brain and can make all these positive changes that happen, which are the functions of the mind. It's very interesting for us to know many researchers in the area of neuroscience and music, neuroimaging studies have revealed that how brain processes music is amazing, that many parts of the brain is involved. Singing or listening to music is a multi-sensory stimulation, and it can also engage in a motor framework. And music can make changes through the neurons firing and also the communication. They can make changes in the brain, and they can also connect the different parts of the brain. If you look at how music is being processed in the brain, there are so many areas of the brain which are processing different aspects of music. It's amazing to know that when we are listening to music, when you are singing, or when you are playing a musical instrument, we are hearing, we are listening, we are seeing, we are perceiving the music, we are feeling the music, we are moving to music, we coordinate with music, we remember to music. How many things happen relating to the cognition and emotion and the sensory stimulus, or the sensory integration. If you take Indian classical music, if you put the, even if it is going to be just the Sarali Varasa, the first foundational lessons, it's going to have, auditory, visual, motor integration. There are three things that are integrated. First, the child, or the person, the child has to see the book, so it's visual stimulus, which is being processed in the brain. It is auditory because it listens to the teacher, and it perceives because she has to understand about how that particular swara is being sung. And motor, she has to put the talam on the lap. See how many sensations are involved. It is feeling, it is seeing, it is hearing, it is listening. And if you look at motor cortex, as I was telling you, we have known that it is possible that we make movements. That's because when we are listening to music, or when we are singing, or when we are playing a musical instrument, or when you're writing a song and singing a song with a therapist, then we are involved in movement while dancing or playing an instrument or singing or listening. And there is prefrontal cortex, which controls the behavior and expression and decision making. There are different, I'm not going into detail because it's just to give an idea, a brief idea of how the different parts of the brain are involved. So it's no more just a left brain activity, it's also a right brain activity. And that's the reason why principles on the biological, and there are neuroimaging studies have revealed the positive effects that all these regions are stimulated. They make changes in the brain, positive changes in the brain, and they connect the different areas of the brain. And because it connects the different areas of the brain, if at all there is a problem in one side of the brain where it is affected, the other side is stimulated. And that communication is passed on to through the corpus callosum, which connects the both sides of the brain to the other side. So this is a very important understanding biologically. Of course, it is a very, very big, diverse areas, and music cognition and cognitive neuro psychologists and neurologists and neuro physicians and neurosurgeons, and it is an interdisciplinary study, and there are so many researches that are happening to understand about the effect of music on the brain and how it is translated into the knowledge is passed on to the music therapist and others in order to understand this and use music as a way therapeutically in the hospital settings as a restorative healthcare strategy, of course, as a complementary manner. So again, I'm just here looking at the properties. I was talking about, the physical and the psychological properties, how it can regulate breathing. You can reflect that if you're going to listen to a very soft music, and also, a music which is very, very slow, it regulates your breathing. If your breathing is very shallow, probably it regulates your breathing, it reduces stress, it improves moods. It's a medium of expression. There's a popular saying, where words cannot, where words fail, music takes over. And it garners attention and focus. We know that it's a way by which it garners attention, and it stabilizes physiological responses. It evokes imagery, visual imagery, which can give us positive emotions. It calms and relaxes. It improves socialization, taps emotions, and we can see that these responses are both related to the mind as well as the body, to show that the mind and the body are related. They cannot be compartmentalized. We are looking at music therapy and music as a mind body medicine, where music acts on the brain, because it's the brain where all the complex functions of the mind takes place. All the functions of regulating the emotions, coloring the music with the emotion, the responses with emotions, or the thoughts, or it is retrieving the memory of something that happened in our life, or it can be motivation, or it can be motor area that is primed. And all this communication in the form of neuron communication, it is transferred to the autonomic nervous system, which takes care of, the responses like blood pressure, and the responses which are not voluntary. Okay, they are not conscious movements. They are not conscious rhythms that we have in our body. The blood pressure, the respiratory rate, the heart rate variability, how it impacts them, and how that information also impacts the endocrine pathway, which is about hormones. How it can impact positive hormones, hormones which can reduce stress. There are researches which have indicated that the information of positive emotions and positive thoughts can reduce the levels of cortisol, which is an index of stress levels in us. And if it is going to be reduced, then the stress is going to be reduced. And how we are going to use music as a preventive healthcare strategy to reduce everyday stress. It has been indicated through research that music makes an impact on the endocrine system, the neuroendocrine system, by reducing the stress, by secreting positive hormones, by reducing the secretion of negative hormones, and also facilitating, or we can say that it influences the immune pathways. Salivary immunoglobulin A is a protein. It's an antibody which supports the immune function. And there are researches which have indicated that music can increase the salivary, this antibodies, which supports the immune function. So it is a mind body, it's a science in which we are understanding music to have an impact on the brain. And the complex processes with music happens with different areas of the brain, which are getting connected positively, which are changing positively. And this information is passed on to the different systems in our body. The autonomic nervous system and endocrine and immune pathways are relating to the body systems, or the organs in our body, which regulate different organs. And this relates in physical health. When it's going to be positive, it's going to, this is because of the, when emotions are positive and then the stress is reduced, we are going to be engaged in healthy behavioral patterns or healthy behavioral aspects, which result in physical health. And that is why, the psychoneuroimmunology is a very, very trending area, which researches on. Psycho is something to do with the mind, neuro is something to do with the brain, and immunology is something to do with the immune function. And the effect of music on the psychoneuroimmunological research has given adequate input on how music can be beneficial to reduce our stress, which is again, a function of the mind. By reducing stress, by coping with stress, by improving on regulating our emotions and thoughts and moods. And if your thoughts and if your emotions are not regulated, then it is not going to have a positive effect on our mind, and in turn, it's not going to be positive on our body. It's going to affect these brain information transfer systems in a negative manner. And so that's about mind-body medicine. So I think we have come to the last slide, and so before getting into the relaxation, I just want to say that the emotional mechanisms, it is not just that we listen to music, then that emotion, we are feeling that emotion. There are complex mechanisms through which the neuropsychological mechanisms that happen in our body and mind, which makes us get that particular emotion, a positive emotion. And that positive emotion can be because of pre-wired responses to simple acoustic characteristics for which, there is already the communication has happened, and, the neural pathways are strengthened. So they are pre-wired responses to acoustic characteristics like loudness and speed. This is why, some of us, don't like very loud volume. We don't listen to music. So it's pre-wired, or, when we are going to have a particular kind of an amplitude, if you're going to have, then probably we may have a positive emotion. That positive emotion can be anything. So it may be because of the pre-wired brainstem reflexes, that's happening in the brain. And so already, it is the connections are made, and then, the neurons have communicated that, and that is why we are able to respond to that simple acoustic characteristics. It's more because of the structure of that musical piece that, we are listening to. So that may be the reason why we get that positive emotion. Or it may be because very slowly the music is acting as an external pacemaker, and in the internal rhythms are getting gradually adjusted. It may be a blood pressure, or it may be a heartbeat. Very slowly it gets adjusted. And so if it is in with two frequencies, then the music is definitely supposed to be slower tempo, and also has to be in a slow tempo. And it gradually, and if the blood pressure and the respiratory rate, they have this frequency, it comes to this frequency because this acts as the external pacemaker. Music acts as an external pacemaker. So this is on the principles of entrainment and probably the positive emotion. We can say Shanta Rasa in our Indian music. So we can say that it's because of that. And evaluative conditioning. Sometimes we are so habituated to get a particular response because we are conditioned to that response, right? So we are so used to listening to a particular raga, and whenever we are listening to that particular raga, or it can be a particular musical piece, or it may be any genre, right? Then it is that we are going to, because of the regular pairing of that particular music with a stimulus, positive stimulus, we are also, because of the conditioning effect, that we can have that positive emotion. Or it can be related to the internal mimicry of the perceive. We can, when what is perception of the music, perception is, you can find out what is the music is trying to give you, what kind of an emotion that you see in that music, but you may be in a different emotion. So if you have to feel the emotion, then you may perceive it, and the feeling and the perceiving has to be resonant, right? So if you feel the music to be particularly, if you perceive the music to be positive, or it can be a joyous mood, or an emotion, you must be in a joyous mood. Research says that you have to be in a resonance to match the perception in order to feel that, right? So it's that because of the internal mimicry of the perceived. So sometimes you don't feel, but you want to mimic that particular, perception that you have about the music. How many times that, when we go to, some of us, when we go to a movie, we start crying when, the heroine, or, the heroine, the one who will cry. So hero will not cry most of the time. So when the heroine cries also, we will also cry, or if there is something a very strong emotion that is being displayed, we will also cry, because we are trying to, it's not that we are sad, but we want to mimic that. So it may be that a contagion response which is relating to internally you in the brain that it is trying to, the neurons try to mimic and the perceived emotional expression of the music that you are hearing and listening. And sometimes the music has the ability to bring in an imagery, a visual imagery, and that visual imagery may have, it may be a hope that you're having in the form of an imagery, or it may be a dream in the form of an imagery, or it may be something that you are positive that you are trying to. So normally an imagery can be, it's a multi-sensory experience. It's not just always visual. An imagery can be visual, it can be auditory, or it can be even olfactory, or it can be in the form of any sensory modality. But visual imagery is specifically, if we are going to get a visual imagery which is going to be of generating a positive emotion, then it's because the emotional nature of the visual imagery, then the listener gets into a particular emotion because of that music. Episodic memory is what we have been seeing throughout, that it is possible that through music, it's possible that we can retrieve the memories of something very pleasant that happened in our life. And we can get positive memories out of it. And so that's episodic memory. And sometimes it can also be because it's a gradual unfolding of the musical structure and your expectancy relating to it, right? So you can expect it or it can be unexpected, and the emotions coming out of that musical expectancy. These are all related to the neuro biological and psychological mechanisms through which you are getting a particular positive effect of music, for you to just have an understanding. So we are going to look at, we have been always looking at the scientific aspect, and now to come into the philosophical aspect. Indian philosophical approach to music was considered to be a way by which we can engage in a meditative experience. If you look at the philosophical aspects of music, it's like the entire world is made of nadam. The entire cosmos is made of nadam. And it is from this nadam, it is the om, the primordial sound, came in from the cosmic sound, the sound vibrations. And from the om, the primordial sound, came the Vedas. And from the Vedas came, all the four Vedas. And from Samaveda came the classical music, right? So we believe and we worship Nadam, the cosmic sound, as Nada Brahman. And there are philosophical orientations believe that music is a way by which it's a medium of expression in which we can meditate and get into self-realization, which is a very very important aspect of Advaita, a stream of philosophy. And so getting into self-realization and understanding about the getting a self-awareness about our senses. So music has always been used as a meditative experience, a philosophical practice, a mindful practice towards self-realization and self-awareness, which is again bringing a balance between the mind, body, and the soul. One of the earliest, places, or we can say even 3,500 years before, the modern mind body medicine, psychosomatic medicine, integrative medicine, all these are 20th century inventions of science. But if you look at Indian philosophy and Indian culture and Indian musical tradition, we were able to look at the connection between the mind body medicine, even in Ayurveda, in yoga, in music, which always connected music with the mind. So we knew the connection between the mind and the body, and meditation was a way by which we could get into practices to understand about self-realization. And of course, it's a different, altogether a different stream to understand about the philosophical practices. But music was always interpreted as a philosophical practice to understand about self-awareness and self-realization. So chanting and singing were considered to be the meditative practices to understand about the functions of the mind, to understand, to regulate our emotion, to regulate about about the different sensory stimulus that we have, how to understand how we respond to different sensations and how do we perceive it, and all that is about self-awareness and self-realization, of course, about what is right and the goal in our lives. If you look at the philosophy, it is about self-realization, about the ultimate truth, and about coming out of ignorance, and getting to know about the true jnana, right? So all the philosophical perspectives, the scientific perspectives, and also, the theories in art. There are so many theories in specifically with relation to Indian classical music and different music-related theories, musicological related theories, which back the therapeutic application of music as a restorative healthcare strategy, wherein the focus is health of a patient and it's just not curing the disease. And it's also that these are all meditation is a wellness practice. Chanting is a wellness practice. There are lots of researchers, even within India, that there are a lot of researchers which have indicated that chanting can be used as a way to relax. So now I'm sorry, it's a monologue, the entire this thing, and there is no way because of the virtual platform, and we may have lots of lags. It became a monologue, but I think we are gearing in for a relaxation session, and that's the last part of this talk. I'll be very happy to give a relaxation session, and it has been recorded because it's a virtual mode, and so live singing can have some lags, and so the script of relaxation and the induction and the deep relaxation process and the music, everything is recorded, and I invite you all to be a part of this relaxation session. And if let me know, Janani, if it works now, right?
Yes, ma'am. Sure.
This is a beautiful, pleasant evening. This relaxation session will make you feel calm, peaceful, and relaxed. Sit comfortably on your chair and close your eyes. Start observing your breath. You're breathing in and breathing out. While you're breathing in, observe that you're inhaling fresh air which flows inside your body and fill your lungs, and you feel fresh. While breathing out, gently feel all your day's stress, negative emotions, and thoughts are released. Breathe in and breathe out. Breathe in and breathe out. Now you become more relaxed with your breath. You're going to listen to the music that's going to be played now. Listen to the music mindfully with an active focus and feel the music is flowing through your entire body and fill your mind with peace and calmness. Feel all your stress is gently released from your body and the mind, and you are becoming more and more relaxed. Now, the music is going to come to an end. You feel more and more peaceful and calm. Your body and the mind are in a state of deep relaxation. Be aware that you can return to this relaxed state anytime you want. Become aware of the environmental sounds and the place you are in. Slowly return to the unrelaxed state when you are ready. Open your eyes very slowly and stretch your arms and legs gently.
So I hope that was a relaxing experience. To conclude, music has an impact on the mind. It reduces negative emotions and stress and induces positive emotions and thoughts and impacts health positively, promoting good physical health. Point number two, music reduces anxiety and depressive feelings and relaxes the mind. It improves mood. It reduces stress, improve coping with the distressing situations, and improve resilience. It can be an effective prevent care health tool to take care of the mental health, which impacts health positively. All these, aspects are functions of the mind. Getting anxious or depressive, or to go low in the mood, or to feel something to be stressful, are something which can have a negative impact on our health, and music can address all these things, and it has been researched, and research indicates, practice and research and uh, education, music therapy education indicates that music can reduce anxiety and depressive feelings. It can be a very positive way of impacting the mind to have a positive health, which impacts the physical health in such a way that we have a good physical health and impacts the health positively. Thank you very much for the wonderful opportunity again to the Classical Arts Club and Saathi Student Wellness Cell, and I hope it was a useful one. Thank you for your patience and for listening to the lecture, a long one.
Participants, if you would like to have ask any questions, please post them in the chat section.
Ma'am, there is one question that is, I wanted to ask about how other traditions of music, say Western classical music, is used for music therapy.
Uh, Actually speaking, this music therapy started well before even 50 years as a very um, uh, regulated discipline, academic discipline, and they have done. There is lots of research on Western classical music being therapeutic, and it is practiced. It is also researched, And there's lots of evidence that Western classical music is used in therapy sessions.
Ma'am, there's another question which says, I wanted to know how music therapy can be used to improve positive self of dyslexic kids.
Positive side
Positive
Positive
uh,
self
self
of
of dyslexic kids, ma'am. Positive self.
of dyslexic kids. See, the developmental, of course, we have not gone into, the developmental aspects of the therapy at all. So definitely music therapy provides a lot of motivation. It improves a lot of self-confidence, and it helps in lots of, the motor. See, if you look at into the developmental aspects of a child, you have the motor skills, you have the emotional skills, you have the psychological skill, emotional skills, the cognitive skills, the pre-academic skills. There is also a mental component, the psychological component. Music can always, make an impact on the psychological component of motivation, becoming enthusiastic, improving the self-confidence, improving the self-esteem. These are the ways by which, uh, definitely, the kids would be benefited more on the functions of the mind, the psychological well-being, which may be an issue probably in them. So the way by which you can tackle this dyslexic kids in an effective manner.
Any further questions from any of the participants? Ma'am, I had a personal question, and if you don't mind. So I just wanted to understand as to whether listening, or what would you suggest is any form of concert music that is available today accepted as therapeutic, or do we have to specifically look for sources?
Thank you, Akshat. So that was really a very nice question, and the lecture wouldn't have become complete with this question without this question. So all modes of musical experiences like listening to music or singing or writing a song. Music therapists work with different methods. So it's not just only listening to music, and it is a socio-cultural experience. And if you looked at, giving a positive emotions, giving a positive thought, retrieving the long-term memory of, this thing, these are all personal experiences. So it has to be a customized experience. Music therapy is a customized experience, or we can say that it is a personalized experience. It's not an individualized experience. Everything is there will be one piece of music which can bring in positive emotion, to everybody. So the context and the socio-cultural aspects of music and being a personal experience makes it to be customized. And of course, there are certain relaxation music probably can work for majority of the people, but generally, the music therapists work within the cultural profile and the musical profile of the person with whom he's working. So it's not always a particular genre which is promoted by the music therapist or the music therapist. They may be trained in a specific genre. They may be trained in Carnatic music, or they may be trained in Hindustani music, or they may be trained only in Western classical music, but they must be open always to use the musical experiences as would a client want, as would the patient wants. And it is more like, it's client centered. It's what they feel pleasurable or how it is therapeutic. Because as I told you, it's the therapist's relationship with the music and the patient's relationship with the music, or the client's relationship with music, or even if it is wellness, it's what is it that you can be engaged in, what is it pleasurable for you, what can bring in positive emotions to you. That is completely subjective. So there is a very major component of subjectivity in this selections of music, and also the selection of musical experiences which are very personal. And so we cannot generally, that is one of the misconceptions, that the music therapists prescribe certain music, to be listened to at all times. because our moods may vary. The context that we are in we may require some other music and not this particular music. So not all times, always 24 by 7, 365 days we would listen to one music and it will have the same effect. And probably, and it is also, it may be for one person but it may not be for all. And so we cannot specifically say that can be one music which we can specific. There can be, as I told you, there can be certain musical pieces which go by the structure. Like for example, a relaxation music definitely has to have a slow tempo because it works on the principles of entrainment. That means, if your blood pressure and respiratory rate has to slow down, and you have to relax, then it has to be a music which maintains a slow tempo throughout the entire time that you are listening to. So such things, probably, it is possible that you can find certain things which can match your requirement, and probably, only for the sake of relaxation, maybe you can do it. But otherwise, it is specifically, depending on the context, and the socio-cultural context, the socio-cultural aspects has to be taken into consideration, because music is a socio-cultural experience.
Right. Thank you so much, ma'am. I think that answers another question that was raised as to whether Western rock music also has a positive effect on relaxing the mind. Um, I think we can take one more question, no, Shashank?
Yes, ma'am. A couple of people have asked about the same thing, as in regarding the usage of ragas in healing, and some particular specific ragas which have greater therapeutic effects.
No, that research has not been. It's very complex to, and no research has been. Though it says there are lots of researchers which have been using ragas for relaxation. It's very complex to say that this particular relaxation aspect is only because of the melody and not because of the other structures. Because all over the world, it has been established slow tempo and soft timbre has been two determinants of relaxing. So if it is going to be a fast tempo music, and if you look at our music, we also sometimes we have to adapt it. The way we also give the ragas. Clinically, we have to adapt it. We have to make it like it has to be made specifically for the relaxation purpose. And also, it doesn't answer the questions why other ragas cannot be used for relaxation if we are going to make it, adapt it, and then give it. So in my own experience and in my own research, it's a little bit difficult to say that only specific ragas can have therapeutic effects. And so, saying that only a particular raga can be relaxing. And so, we use classical music here in our relaxation. But if I'm going to have another music, probably tomorrow, and then the same set of people come, and it's we have adapted in such a way that we have taken the determinants of relaxation music, which should fit in understanding about the processes, which may be the principles of entrainment. So here, the structure, if you're going to vary it and probably give, so it's the structure sometimes, which is more important in understanding, the outcome and therapeutic. And so also, because it's a socio-cultural experience, the receptivity with the patient and the patient's perception and feeling of how the musical experience is positive is very important in therapy. And so therapy is basically, not technical music, it's functional music. Sometimes the lyric is important because the lyric may give a motivation when it's couched in a melody, and the patient may not even know in what raga the song is written. So it's a little bit complex, and so probably we may have to do a lot of whatever researches have been done with the um, um, specific ragas to have a clinical outcome. We need more deeper research to understand that others don't work and it's only thing. And as I told you, there is no way that we can talk about cure and we more get into the health. And so there are some parameters which have been steadily looked into with the different ragas having positive effect, but in the direction. But we have no answers why other ragas cannot be used if we are going to use. So it's a little bit complex, and I don't have an answer, that a direct answer to tell you that only specific ragas are therapeutic and other ragas are not therapeutic. I don't have any answer now which I can say very confidently with my experience and with my practice experience in research. More research is needed on that level.
Thank you so much, ma'am. There is we can we take one more question or shall we close?
Please, let's take the last question.
Okay. So the question is, are language and lyrics also connected to therapeutic effects, or do we consider music standalone in this regard?
As I told you, it's only the music medicine wherein people who are not trained in music and who are not music therapists, when they use pre-recorded music, who rely on the direct effects of music, only then music is a standalone. In music therapy, music is not standalone. There are verbal discussions, there are therapeutic discussion, there is a therapeutic relationship, and we use song reminiscence. Song reminiscence can also be, with lyric, and there will be lyric discussion. Sometimes, it may be the lyric which has motivated them. There are motivational songs that we use, the film songs, motivational songs which motivate them, so nicely. So definitely, it is not standalone in music therapy. In music medicine, it is standalone because it's just mostly, it is instrumental music or where the lyrics can make the process complex. Like, they can, instead of regulating the emotion, they can, emotions may surface or cognition may surface, thoughts, and that makes the relaxation process complex.
Thank you, ma'am. Thank you for patiently answering questions. Shashank?
Yes, ma'am. Thank you very much on behalf of Classical Arts Club IIT Madras and Saathi. We extend our sincere thanks to you for agreeing to host this session and for your valuable information. And the it was overall a very enjoyable session, and it was quite informative and insightful. We request the participants to kindly fill out the feedback form so that we can use uh, we can use the same for planning out our further sessions. And we thank all the participants for joining in, and we hope to have you at our future sessions as well. Thank you much.
Shashank, there are some more questions. Probably, you can collect the questions and feedback, and probably we can see, if I can answer. So, there are lots of questions coming up, but we don't have the time. And probably, you can find out if there is any way. Yeah, if it's possible, I'm open to it.
Ye-
Sure, ma'am. Sure.
I think you've pretty much answered most of the
Uh,
questions, ma'am. But
Ma'am, the questions in the chat we have already taken them as
also, just another announcement. Please follow the Instagram and the Facebook pages of Classical Arts IIT Madras for further updates on concerts and sessions like these. And I think the same holds for Saathi IITM as well. Thank you so much.